It's great to see all of you here at our Maricopa County Spotlight Zoom event for the month of April 2021. Yes, we're still doing the events by Zoom. Hopefully we can meet in person again soon. So this is a wonderful way for us to get together as senior healthcare professionals to learn more about each other's services and how we can serve the senior adults in our community better. We have a great event planned for you today. We want to recognize our co-host, George Phillips. George, you want to take just a moment?
Yeah, absolutely. George Phillips, just-in-time moving and storage. We do local and long-distance moving, so if we could be of any assistance to any of you out there, we'd love the opportunity to help. I'll put my information in the chat. Thanks, Kyle.
Terrific, thank you. And you'll find George in our current Spotlight resource guide, just-in-time moving and storage, on page 61. I also want to recognize Robin Valentine. She's with Spotlight as well. Robin.
Good morning, everyone. So glad to see you. And I am enjoying this spring weather. I hope you guys are as well. Things are really starting to move. I'm getting a lot more people sending in events that are going live, barbecues, open houses, things like that. So if you have anything that your community or your services are providing as far as events, feel free to send those over to me and I'd be happy to put those on our website and on meetup.com for more exposure to your events. Anyway, so I'm here to serve you. It also goes for any support groups or job postings or anything like that. If you have those type of items, send them over to me. Thank you.
Terrific. Thank you, Robin. Appreciate that. So we have a great event planned for you today. First, we want to put the spotlight on Homestead Hospice. We're so happy to have them with us today. I think we have Stacy, and I'll let them introduce themselves. Homestead Hospice, go ahead and unmute yourself, and now's your time.
Hi guys, good morning. It's nice to see a few of us on so early. My name is Lisa, and I am a community liaison for Homestead Hospice and Palliative Care. This is Stacy. She's our administrator. She's also an RN. We, of course, service the entire valley of our patients who need any additional higher level of care. One thing that I really like to point out is that our palliative care is actually handled by a nurse practitioner. So we actually go out, we see our patients approximately once a month, sometimes a little less, sometimes a little more, depending on the need of those patients, which makes us a little bit different than a lot of those palliative cares out there in the valley because we do see them in person. Hospice, everybody has probably a little bit of information about that. That's basically the same for all of us in the valley. I like us obviously a little bit better just because we are, we're not massive. We are not obviously the big bucks in the valley. Nothing wrong with any of those, but we feel that our services are a little more tailored towards those patients that need a little more hand-holding, and they're not just a number. They actually are going to get the same care from the same staff week after week. So thank you for having us. It's great to be on and be part of this. So thank you.
Terrific. Thank you. Do we have any questions for Homestead Hospice? Go ahead and unmute yourself and feel free to ask them any questions.
So I think something too that we can kind of discuss that makes us a little bit different than maybe some of the other companies that you guys have worked with would be our response time. You know, really, we understand these hospice patients are at a time where they really need that extra level of service and that extra TLC. So our response time is quick. My CRMs, you know, Lisa's my senior CRM, and I have 2 other ones in the field, and, you know, they are very responsive. They, you know, they try and get there within a couple hours of receiving the referral if the family's available to meet with us. Because again, we really value that referral and understand that these patients are really at a delicate point and they need those services quickly. So I think that is something else that I would like to mention that definitely sets us apart from some of our counterparts, that we, you know, really are responsive, and the follow-up as well. I will kind of toot Lisa's horn. You know, you send us a referral, it's not just gone, it's, you know, follow-up, it's us letting you know where we are in the process, what have we done to help the patient, what maybe other services do they need that we're, you know, helping get into place. So it's really a multi-team, you know, multi-member team approach to what we do here.
So I have a question, and I'm not really sure the answer or how it's going to work, but this is Jennifer from Neighbors Who Care. And, you know, at my particular stage in life, myself and a lot of my friends have aging parents, and they are starting to get into the place of needing potentially a hospice or palliative care. And there are a lot of stubborn seniors out there. And while family and friends all see the need for hospice, potentially, it's convincing not only the senior, but sometimes even their spouses that, you know, because hospice has the stigma with, you know, and it's real, but hospice is also just so incredibly helpful during this time of transition. And so what is your approach when you find somebody who is just on that stubborn side and just says, I don't know, I don't need hospice?
Really not pushing anything that they're not ready for, right? And that's why it's beautiful that we have an NP-driven palliative care program. That's why, you know, Lisa is so great at her job, and my other CRMs that are in the field, they will go in and really hold hands. Again, that hospice word does have a stigma around it, and we understand that. So sometimes we just use the word palliative care because palliative care is hospice, right? You know, we're palliating symptoms on hospice. So, you know, we will do what we need to do to make the patients and the families feel comfortable, but also not push them. You know, they have to be ready to accept this level of care and be ready to allow us to come in and care for them. And I think once they sit down and meet with someone, a lot of times that is just, it goes away. That scared, you know, being scared and, oh my gosh, I'm dying tomorrow type thing just goes away, because again, Lisa goes in and does such a great job educating on what services we can provide and how we can help the families. And a lot of times patients agree to it because they want to help their loved ones. And so they're maybe apprehensive themselves, but their husband or son or daughter or someone is saying, you know what, mom and dad, we could really use this extra help with the CNA coming in 3 times a week and a nurse coming here to you. Then we could go maybe take a walk, you know, push you in your wheelchair and take a walk around the park instead of having to try and get into a doctor's appointment or something like that. So those are the things that we point out in our initial meetings with families.
I think one of the things that I do is a lot of times I'll go in and educate the family on just all the services that hospice offers. And at the end, I know there's specifically, you know, maybe husband or wife is the one that's kind of like putting their brakes on saying, I don't want hospice. For me to go in and tell them, here's what we can offer. And at the end to say, would this surprise you to say that this is hospice? And a lot of times they hear that and they're like, oh, well, those really are all the things that I need. And it's just that word. It's just that word that I don't want to hear. And it would not, it happens a lot where, you know, the first few times we're definitely not using that word hospice over and over again. We don't need to use that word. Everyone knows that we are there for a higher level of care. That's what's important. So you're speaking my language. We hear that every day, those stubborn seniors every day. But we are really here to help. And I truly feel like myself, Stacy, our team, my co-marketers, we all have a passion for what we do. The number of hours that we work outside those clock hours to help people with things that really honestly have really nothing to do with hospice or palliative, helping them lead them in the right direction for placement or leading them in the right direction for physical therapy and, you know, extra things like Meals on Wheels. I mean, we have a great social working team. Mm-hmm. So we really do take care of the entire family. Mm-hmm. And we don't just take care of just the things that deal with palliative or hospice. We're really there for the entire patient and their family.
So I like to say there's no bad referral to us, even if they're not ready for hospice and we can't get them into palliative care, which is rare because most patients, once they get to a certain age, have the diagnoses we need to manage on palliative care. There's no bad referral to us. We will get whatever resources they need to them. If that's home health, if that's, you know, maybe a paid caregiver, whatever the resources are that they need, we're there to help them at that point. So again, I always say, don't hesitate to refer to us and let us do the talking, because that's what we're good at. That's what Lisa is, you know, a specialist in, is going in and meeting with the family and really explaining what we can do without it being scary.
Thank you very much, because it's certainly a challenge sometimes, because especially spouses don't want to accept that. Well, both patient and spouse. So in any case, thank you very much. And I know the value of what you do. It's incredible. So
I'll reach out to you. I'd love to partner with some stuff. We've got definitely always have referrals that we can send your way. So
thank you very much. We need volunteers.
oh my gosh, right? Every day we hear that now. I think people are finally kind of starting to get back out there for that volunteering. COVID it was hard for all of us.
Oh yeah, exactly. Anyway, thank you so much. I don't want to take your time.
Thank you.
No, thank you. That was a great question.
Well, fantastic. Thank you so much.
One more, Kyle.
Yes.
Charlie. Hey, I've had, my family's had 2 experiences with hospices, and they knew nothing about hospice. Being in senior healthcare, I knew a little bit about it, and both times those hospices did it perfectly. And I got to say, your presentation here shows us your values. Keep going. You're on the right track.
Oh, thank you.
Thank you, Kyle. Thank you.
Actually, that was Charlie.
Oh, Charlie. Sorry, Charlie.
Wonderful. Well, thank you so much. Homestead Hospice is on pages 16 and 17 and 36 and 37. Yeah, 36 and 37. They are corporate sponsors of the Spotlight program. So Homestead Hospice is there for you. Their contact information is there as well. Next, we're going to put the spotlight on Shadow Mountain Memory Care. We have Mr. Dan Hara with us. Dan?
Thank you, Kyle. Good to see everybody. I know it's been a crazy year, so it's good to see some familiar faces. And so yes, Shadow Mountain Memory Care, we just opened in January this year. Brand new community. One Life is the owner. They're based out of Oregon, and this is their 5th property. So a newer company. So yeah, like I said, I started in September. First residents moved in January. We have 70 beds for 72 residents. For us, it's going to be RN oversight and LPNs. We're not going to have the med techs. A larger activity team. So in 3 months, we already have 30 residents. So it's been a really crazy busy year. I wasn't sure how this was going to go with the pandemic and everything, with residents moving in, but our biggest struggle is finding people that want to work. That's kind of where we're at right now. 56 private beds, 16 shared. Like I said, a larger activity team. Right now we're creating a role for a social worker too. And for some of you that might be familiar with Silverado, where I used to be at, Silverado is no longer in Arizona. It is going to be kind of geared towards like a Silverado model. Pricing very similar. It's shares are $66.50. The privates start at $77.50 and they go up to $10,000. We have 4 neighborhoods right now. We almost have 2 neighborhoods that are full. We're looking to open our 3rd neighborhood maybe at the end of this month, possibly. And then the way things are moving this quickly, and we could be full, I guess, in the summertime. It's probably. As far as residents we're accepting, we are taking behaviors, Hoyer lifts, full assists. That's always kind of been our MO. A lot of our team has worked together for many years between a couple different properties. So we're very familiar with each other, which is kind of a unique situation where even though we're a new community, it's a lot of us have worked together before. So it's pretty cool. Pets allowed. Winston, which I know some of you might know, Winston, my dog, he comes to work with me every day, and the residents, anyone who can move in with dogs or cats. So that's acceptable. Networking breakfast, that's something we'll be doing maybe in May. I'll let you know if we figure out a date. We are going to start doing some things for families. Families started to come in for us Friday, so they can visit inside. And so things are starting to get to some type of normalcy, which is we've all been excited to see. Everything comes in, hospice, we partner with hospice and all the different mobile providers. We have a medical director, Dr. Atkinson. So I think that's, a little rundown. So we're located at the 51 in Shea. The nice thing about our location is it's really easy to get to. 51, usually traffic is, isn't too crazy. So families are coming from up north, they're coming from south, and our staff too. So everyone's it's a good central location for our team and for families. So yeah, any questions?
Oh, Dan, that's a loaded question. I have so many questions. I do have one question that I think we run into this problem all the time. And I'm wondering if this is just a pipe dream for me, or if we'll ever get to this point. I would love to see a memory care that has an RN staffed full time so that we could do respite and GIP, because we have such a large population, obviously, of our patients have Alzheimer's and dementia. And we have such a hard time finding anywhere for them to go because a lot of them are walkie-talkie. And we have to have them in a secure environment. Will we ever get to that point, or do you tell me if I'm crazy to think that will ever come?
So when you say you're saying RN 24/7 or RN just oversight, like director?
It would have to be a nurse, at least an LPN or an RN 24/7.
Yeah, that we have that. So we have the RN oversight, and then we have only LPNs on the floor. So we're not going to have med techs.
We can try, we can ask, yeah.
I'm definitely gonna buzz out and chat with you because I always need somewhere for my patients to go for respite. So many of our families with an Alzheimer's and dementia patient, it's a lot of work. It's a lot of work in general to be a caregiver, obviously, but with Alzheimer's and dementia patients, it just seems like they are just running ragged. And so I will definitely buzz out there and can ask.
Come on out. Our address is 10030 North 32nd. So if you exit the 51 in Shea, 32nd Street is right there, and so we're easy to access. But
great.
Yeah,
I'll bring Winston a treat.
There you go. He can always use another treat.
Terrific. Any other questions for Dan?
Dan, are you doing activity? Sorry, I'm taking over.
Oh,
Dan,
it's okay.
Dan, are you doing activities yet for your residents?
Yeah, I mean, we've been doing that since we opened. So, we just, we're being safe still, keeping things spread out. But I think right now, like in May, we have a booked calendar 5 days a week for live entertainment too.
Awesome.
So, for us, we've always been used to that, like live entertainment, Zumba, we get creative. So we're excited to get back to that because obviously for all of us the last year, it's like you're not able to do all the things you enjoy doing, I mean, I used to take residents out to lunch with me at Portillo's or go to Home Depot and go shopping, and all those things you kind of took for granted that we haven't been able to do for, over a year now. So we're going to plan a car show. So the day before Mother's Day, we're going to have our first event. We'll keep it spread out and safe and everything, but we're going to have a car show with live music and classic cars. So yeah, I mean, we all got to keep moving on with life. Everyone's getting vaccinated. Our residents are all vaccinated. Most of our team is. So, we got to move on.
I always tease Stacy. I'm like, memory care is very dear to my heart. I wish that I could just stop, honestly, just volunteer every day in memory care. I love it. So if I show up, you might not get rid of me. I might
all right, that's a deal.
Your residents all day.
Fantastic. Well, thank you so much, Dan. We appreciate you joining us today. Shadow Mountain Memory Care. You'll find them in the current Spotlight resource guide on page 98. So the contact information is there for you. Next, we want to put the spotlight on Bright Star Care. We are happy to have with us Katie McDonald. Katie, if you want to unmute yourself, your time is now yours.
Sure, can you hear me?
Yes, we can hear you just fine.
All right, I'm muted. Hi guys, my name's Katie McDonald. Bright Star Care is our company. I'm one of the owners. We have an entire Bright Star Care team that services pretty much most of the valley here. But we have offices in Scottsdale, Tempe, Mesa, Glendale, and Tucson to try to kind of serve that entire valley. Let me just tell you a little bit about Bright Star Care if you're not familiar. So we are a private duty home care company, but we do provide the full continuum of care. So we take them, so we have non-medical services as well as medical service. So our goal is to pretty much take a client where they are and keep them in their home in whatever services that that they need. So we are, I would say our niche is we kind of partner with pretty much everyone in this valley in some type of way to help them in their services. We do a lot of partnerships with home health agencies, a lot of hospices, placement agents, pretty much everyone, because there's some way that we can kind of, you know, get in there and help them. We do medical staffing as well, which is a little bit of a difference. So in that, I'll kind of, okay, on the medical staffing side, there's kind of a couple different divisions. So in an instance with like a hospice, a home health, an assisted living, in situations where you're short-staffed, for an immediate need, maybe someone goes on maternity leave, you know, those types of situations where you're not looking to go through the entire situation to pull in a new person. You just need someone temporarily that's extremely qualified, that's been vetted, that's gone through every single thing. We really pride ourselves on that 5-star standard. There is no one that works for our company that hasn't been completely vetted and competency tested. Our director of nursing oversees everything, and our RN case managers to make sure that that everyone that's going out is completely qualified. But yeah, we can help in those little, you know, situations where you just need somebody quickly. And then also we do a lot of medical staffing in, like right now, our newest contract is with Albertsons. We actually just took on that to where we're doing all of our nurses are going out and doing the COVID vaccinations in different clinics, and we'll be doing them in their stores as well, the Albertsons and Safeways. So a lot of recruiting and things going on to make sure we're staffing all of those. I mean, we need to like 75 nurses like over a weekend. It's like, crazy. So we really try to just, you know, wherever the needs are, we try to pivot. This is a crazy environment that we've been in, and things have changed. And, you know, not being able to get in certain areas and different needs, staffing became a bigger issue. And so what we've been primarily home care and doing home care. Now we've, you know, shifted and done a little bit more on that medical staffing side. But primarily it's keeping people in their homes. That's what we do. That's what we love. And we will do anything that we can to follow these families and our loved ones in this process. So the reason why, I mean, my husband and I own, we work out of the Tempe office. When we took this on, you know, actually right behind me, this Bright Star Care, that's actually on my back. These are our core values. You know, be open and positive, serve with passion, do the right thing, do what you say, make it great. We serve with passion. My husband and I are very involved in our business because we need to see these, you know, these seniors in our area are amazing, and they need to be loved and taken care through the whole process. So we've got clients that come in, we have no minimums. So some of them come in where they're just needing like a trip to the, you know, their doctor's appointment, and they want to make sure there's a caregiver there and getting them in the car and stuff, and then taking them home. And they turn into forever clients. You know, they start there, and then, you know, daughter notices that there's some kind of a decline, you know, Alzheimer's may be coming on, you know, and something's not quite right. And we have our nurse come out, we do a living room visit, and we talk with the families, and we really get the full grasp of what's going on. And then we come up with an individualized plan of care for them. And, you know, what might start off with a family need of a couple hours a week turns in, you know, to where they want to just keep them in their home and it's 12 hours and, you know, this and that. And then that client needs, now is in need of hospice. And so we bring in a hospice partner and we help, you know, coordinate those services so that they have the services that are available under their Medicare insurance and things like that. And then we also take the other part so that they have that one-on-one caregiver with them that's part of their family and that's being supervised by a nurse. 100% of our clients are under that umbrella of a director of nursing. So they are, whether they're medical or they're non-medical. That's a huge differentiator in our business. We are home care. We're not home health. We're not Medicare billing. We're doing all of the other things, not the Medicare billing. So we have that ability, you know, to be a complement, you know, to let's say, you know, we had our Homestead Hospice that was, you know, earlier on. So, you know, they're doing the pieces that they, you know, can do within a certain, you know, the billings, the insurances, all of that. They have certain protocol, but maybe family is like, I just need some respite care. Like I just need some help, you know, and hospice is like, I need to find somebody, you know, that can just give those extra little respite hours or whatever. So that's, you know, we come in, we do that. But then also have the director of nursing, you know, and all of that paperwork under the umbrella that can talk with the nurse on the other side and make sure that there's that huge quality and assurance there. So
question.
That's a big deal. Joint Commission accreditation is with all of our clients, even non-medical.
Katie, quick question. So if I want, I always could use your services. Tell me, so if you are in Tempe, so is there like a one number and then give them the address and then they tell me which location to which owner?
Yep.
Are you go by zip codes or are you kind of?
Yeah, so we're by zip code, but we work extremely close together. So if one of us is not, you know, able to help, a lot of times the other one will take it. So we kind of, you know, so that we can serve that whole valley. Yeah, you can call. So like if you were to call, you know, 480-897-1166, that's our main office. We will either, if you want, direct you to the right area to make sure you're getting the right staffing, or we can handle that and just, you know, get it to the right people and make sure that you're taken care of. Absolutely.
Perfect. Thank you.
Yep.
I have a question. Do you staff communities who need like registry services?
Registry services?
So oftentimes our med techs or our caregivers might call out, or we might be in between hiring full-time med techs and full-time caregivers. Do you have a service where we can call and you can help us staff temporarily?
So we have CNAs, certified caregivers, LPNs, RNs, CNAs. We don't do a lot of med techs or farm techs. We don't do. So it's not really a registry service. I mean, they're all employed by us. So they're all W-2 employees that are going out. It's not just a random, like they are all under our workers' comp, everything. They're all vetted by us. But yeah, if there is somebody that calls off and it's a person we have available, absolutely.
So what I need is your contact info. I scrolled and I didn't really see it.
Yeah, I haven't put it in yet.
Perfect.
So
okay.
All of that stuff on the bottom, please look for that. Yeah, no, we're doing that. We're actually, this last year, we moved into, one of the needs is in these independent living centers. So we went in and now, you know, there are some of these placement agents can put them in a home, like an independent living facility, but still get the services of like a whole, you know, the whole continuum of care. Like they've got, you know, bath visits and stuff. Like we're actually in the independent living facilities now. We just took on 2 of them, and growing, just moving with the needs of the area, really, because we have a lot of versatility with being able to do, you know, the non-medical and the medical. So please, if you hear of anything that, you know, needs out in the community, or partnerships that you really think could benefit, I mean, it goes as far as some, like we just heard, just this last week, there was, you know, a pharmacy and they needed to do infusion, but they couldn't take on the wound care. And so they had to drop that, you know, drop what was being sent over to them. We've got tons of commercial insurances. We don't do Medicare billing, but we have lots of other commercial insurances. So like an Oscar commercial insurance, like not that many people have it. We have Oscar. They can take the infusion. We take the wound care. We're just looking, you know, to find ways to partner in the community. We will, you know, reach out. I'll talk to anybody. I mean, I'm a very active owner. Like I'm not one of those off in the, like any questions, seriously, throw it my way. You can even text me on my cell phone.
Fantastic. Well, thank you so much, Katie, for joining us.
Thanks for having us.
Absolutely. You'll find Bright Star Care in our summer fall printing that's coming up soon. So thank you so much for your participation in Spotlight.
Yep.
We want to put the spotlight on the Parkinson's Foundation. We have Robin with us. Robin, if you want to unmute yourself, and now's your time.
Can you hear me?
Yes, we can hear you.
I think it's working. Okay, good. Good morning, everyone. I'm the development manager for the Parkinson's Foundation Southwest chapter. My territory to cover is Nevada, Arizona, and New Mexico. And my primary focus is developing relationships within the communities to provide resources to people with Parkinson's, so they're aware of where they can go to get the resources that they need, primarily to stay in their homes, to get the care that they need, to get the caregiver the care that they need, provide resources and information for everything that can make their quality of life good and stay good for a longer period of time. We provide a lot of resources such as books in print as well as online that talk about every aspect of the diagnosis. And we bring them hospitalization information, because as much as everybody thinks they know about Parkinson's, they know maybe about this much, especially in the hospital and ERs, where sometimes they land for other reasons besides their Parkinson's. And it's been shown that 1 in 3 people don't receive the proper care while they're in the hospital. And not only that, but 3 out of 4 don't receive their medications on time. They don't receive the treatment for the Parkinson's while they're in there, and they receive medications that will interact with their other medications. That has led to some issues, including death. So we provide them what's called with a free Aware and Care hospitalization kit that they can take with them, that they can go to the hospital with and be an advocate for their own health care. And make sure that they let everybody know that they have Parkinson's, that they need to take their medications, they need to take it on time, and there are specific medications that will interact with their medications. We're always looking for services and places that will work with people with Parkinson's and are very knowledgeable of the disease. Unfortunately, there's not a lot out there that people are specifically trained to care for people with Parkinson's. So we're very select in who we choose to work with. And who we provide the resources to and the connections. My other primary responsibility in developing relationships is also to fundraise in the area. I host 4 events across the states, 3 walks, 1 in each state, and then I also hold a cycle event here in Phoenix. So I have multiple responsibilities as it comes to managing my territory and caring for people with Parkinson's. So one of the things that is proven to alleviate or reduce the symptoms of Parkinson's is exercise, which helps us all, no matter our diagnosis or where we're at in our stage of life. And we encourage everybody to do at least 2.5 hours of exercise per week to make sure that they keep their symptoms at bay. Typically, you can extend the quality of life by up to a year. by doing 2.5 hours of exercise per week for somebody with Parkinson's. So people living 15, 20, 25 years with Parkinson's, and they're living a very good quality of life. They're still going out. Some of them are still working. So we try to make sure that they have the resources available. We provide a lot of research opportunities. We partner with the Muhammad Ali Parkinson Center on one. They just became a center for testing for our PD gene program, which is our largest investment in research. It's a $25 million project over 5 years, and it's studying specific genes as it relates to Parkinson's. And what we're hoping to do with that is fast track research, fast track clinical trials, and come up with some better treatments, because there has not been a treatment found or better treatment found than what we've had from 1980 or 1990s. It's time to find better treatments and better care for people with Parkinson's. I'm not sure if you're aware, but Parkinson's is the second leading diagnosed neurological disorder behind Alzheimer's. So we see a lot more people being diagnosed with Parkinson's, and it only will increase over the next 5 to 10 years. So with our PD gene project, we're looking to study these genes and hopefully find a cure eventually. But we were cited by one of the associations that with this project, we're going to change the world, and we're going to change the world of people with Parkinson's and make sure that they live the lives that they should live with the disease. April is Parkinson's Awareness Month. So we're partnering with a lot of local organizations, such as the Jewish Community Center in Scottsdale, as well as the Muhammad Ali Parkinson Center in Phoenix, on educational programs for everybody from nutrition to home health care to hospitalization to psychosis and cognitive behavioral changes to family support. So we're proud to be able to sponsor these programs and provide them with the funding to host them. One of the things we do is we don't come in and say, okay, let's do all these educational programs, let's do all of this stuff. When it's already there, we help fund them. We help them provide the services that they already have and fund the programs. We have what's called our community grant program, where we fund anywhere from $5,000 to $25,000 to local nonprofits for any programs that will benefit the Parkinson's community, be free of cost or low cost to them, and provides a need that is basically unmet or meets a need in an underserved population, such as Spanish, as well as the Native American population. So we're here to support that and to be able to provide those grants and just partner with the communities wherever we can in providing the services that are so critical to people with Parkinson's. So I appreciate you guys allowing me to come on and talk. I can probably talk more about this. I'm very passionate for who I work for, because they do, not only do they do the research, but they also spend the money where it's needed. And that's right now for the care for these people and their families with Parkinson's. So I'm very happy to be a part of the organization. So I'm open to any questions you might have about what we do.
So, yep, marketer here. I always have questions. I'm so sorry.
Oh, that's
Robin,
fine.
I would love to chat with you more. We do have a few Parkinson's patients on palliative with us, because as everyone knows, Parkinson's can go on for such a long time. I'm wondering if you have services that you can lead those families to, things like water aerobics, water therapy, I shouldn't say aerobics, but water therapies. Is that something that you have connections for that you can help families with? In my head, I have 2 families right now that are just struggling so much because they just don't know what to do, and the resources are limited, obviously.
Depending on where they live, we do have one resource in the Scottsdale area that does provide such a service. I haven't found other areas that do. Not to say that I can't ask and find out from others whether they do offer that or not. They are finding that it is much easier, obviously, on the body, and it's easier for the person to get the exercise, and it does get their heart rate up, which keeps them at bay. So yeah.
I do know of a possible resource in Apache Junction that it's a physical therapy association that does offer water therapies and specifically has case managers that works with individuals who have Parkinson's.
Oh, great. Awesome.
Yeah, that's great. And the one I have out there is a physical therapy place as well that does water therapy and works really well in Scottsdale, that works really well with people with Parkinson's. So
Right.
Absolutely. And I'll put my information in the chat. I have yet to put that in there for myself. But we also place people with Parkinson's in assisted living facilities and in home care facilities. We also provide letting them know that there are in-home care resources. Like we do have Right at Home as a national sponsor. So we do work with Right at Home. We also work with Home Instead. So there's a couple of locations that we do work with because we want them to be, and they have staff that are trained to work with people with Parkinson's because it's very different. We have to make sure, the biggest thing is to make sure they get their medications on time and that they don't take any other medications that will interact with their medications. So the person just needs to be trained to be able to handle that situation, whether it's in their home or whether it's at their care facility. So.
Thanks, Robin. Good information.
Thank you.
Fantastic. Any other questions for Robin? Well, Robin, thank you so much for joining us.
Thank you.
Yeah, and happy Parkinson's Awareness Month. I'm so glad you could be with us on this month. And we're excited to have Parkinson's Foundation in our next printing, our summer fall edition. You'll see them there as well. So thank you for your participation with us. Well, now we want to open it up for announcements or door prizes. If you have an announcement or a door prize you want to make to the group, now's your opportunity to do so. Just unmute yourself.
This is Mike with Smooth Transitions and Fab Finds. I have a $10 gift card for a door prize. But how do we work that?
Well, George has a randomizer, so he'll help us with that.
Okay, and then I just send it?
Mm-hmm. Or yeah.
Okay.
Mm-hmm.
So Fab Finds, we do senior relocation with Smooth Transitions. We do senior relocation and then we do state sales. So we kind of work in between everybody here. So that's who we are.
Excellent. And the winner is Steve Nissel.
Terrific.
So do you want me to, how should I get it to him? I don't know how this works.
We can, if you want, Robin can give you his information, or Steve, if you're on still, you can put it in the chat.
Yep.
Yeah, if you want to put it in the chat, I'll throw it in the mail.
Sounds
okay. You got my address?
Way. I do not. Do you want to just put it in the chat?
Yeah.
Okay.
Terrific. Thanks, Mike. We appreciate that. Any other announcements or door prizes out there? Yes, Kathleen.
I have an announcement. This Thursday in 2 days, we are having an outdoor wellness fair and blood drive. We have over 20 vendors coming and I'm so excited because it's going to feel a little bit like normal. So everyone's welcome to attend, send your family and friends, okay? Thanks.
Terrific. Thank you. And anybody else? You have to unmute yourself and just go ahead. It's hard for me to see everybody.
Yeah, Kyle, I can do a $10 Starbucks card as a drawing.
Okay.
Keisha.
Starbucks, and the winner is Charlie Clifford.
Yeah.
All right.
Donald. I'll catch up with you, buddy.
You will. All right.
All right. Terrific. And I know our corporate sponsor, Endeavor in Home Care, has a giveaway as well. Robin, you wanted to announce that, or is there someone on with Endeavor?
Yeah, I haven't seen. Oh, there she is.
There she is. Yep.
Yeah, there you go.
Yep, we got our Amazon gift card.
Yeah, all right. And the winner is Kathleen Fanning.
All right.
Terrific. And
congratulations, Kathleen.
Anything you want to share with us about Endeavor?
I put it in the chat, but our team is growing. Our marketing team is growing. I've been with Endeavor for about 2 months, and we just brought on Michelle Stelling, who used to be at Encompass in the East Valley. So she's now going to be working our South Scottsdale and Phoenix territory for Endeavor. We're just excited about 2021 and getting back out there, partnering with all of the community partners and being, out there doing what we can for our seniors.
Thank you, and we appreciate your door prize. And thank you for being a corporate sponsor as well with Spotlight. We also have a door prize from Spotlight. It's a gift card to Starbucks. George?
Yep. Winner is Brandon Newman.
There he is. All right, Brandon, we'll email that over to you. It's a digital card. Fantastic. Well, thank you all for joining us. It's so wonderful to see you, even if it's just over Zoom. We look forward to getting together again live. Not sure when that's going to be yet, but look for our newsletters. Feel free to contact us. And anything else, Robin, that I missed?
Hi. So yeah, put us on your calendar for May 11th. We'll be meeting again for our next Zoom event. And, you know, we're really expecting to be able to go live again. We just don't know when that will be. Kyle has a little bit more research to do on when people will open up. So right now, we'll see you next month on May 11th, and then more news to come on when we go live.
Terrific. Thanks, Robin. And we are preparing for our next printing for the Spotlight Resource Guide. If you want to be featured and spotlighted in our Spotlight Guide, reach out to myself or to Robin, and we can give you that information. It'll be our next printing for the summer fall. So thank you all for everything you do. You're all heroes out there, and we congratulate you on your success and look forward to a wonderful next half of the year. I can't believe we're almost halfway through 2021, but we are. And we just appreciate you, and we're here for you. If there's something that you think we can assist you with, please reach out to us. We want to be able to help out as much as we can. So now you can unmute yourselves. It's your opportunity to say goodbye to everybody, and be safe out there. And we look forward to seeing you on May 11th, if not before.
Thanks, everyone.
Bye. Make
Bye.
it an
Good seeing
inspired
everyone.
day.
Save your chat.
Yes. Save your chat.
Bye.
If anybody isn't able to save your chat, just reach out to me. I'll be happy to forward it on to you.
Thank you.
Stay safe, everyone. Bye-bye.